Hi, I'm Dr. Charles Schof of the Mandeville Center for Dental Excellence, and I focus very heavily on cosmetic dentistry. I think it's the one facet of dentistry that allows me to really help, make a difference in patients' lives. Your smile is your advertisement, it's your billboard. It speaks volumes of who you are. So I'm honored to be a part of transforming that or helping you maintain it. So I've seen cosmetic dentistry, you know, uh, change people's lives. You know, people have gotten promotions. Uh, People now, can literally leave their home. I had a patient just the other day, live with some cosmetic debilitation, and it was interesting. I said, "Well, what makes it time now?" And he said his children started asking, you know, why his smile was that way. What, Dad, that's not normal. And so, I'm really excited to help, change his life. He's taken some big steps. I think a lot of people go through life. A lot of this dentistry is about timing, whether it's, uh, changes at work, changes in marital or relationship status. And so, whether, could be people, a bride getting ready to get married and she wants a brighter smile. So, it just goes on and on. But yeah, it's very rewarding for both the patient and our office. So I think the part that really excites me about cosmetic dentistry is, uh, the continued education that I had to really go back. Early on, I got excited. I could fix teeth. I could lengthen teeth. We could put edges. We could restore the beauty. But you realize very quickly, if you don't understand the functional aspects, that that too will break down. And a lot of patients who come in with cosmetic complaints are patients who have functional issues, people who have ground their teeth, uh, uh, or have habitual habits that cause edges of the teeth to wear off. So it's one thing to fix it, it's another thing to identify the problems and find solutions so that the cosmetic dentistry that you do will last for years. So I would say that some of the most transformative cosmetic procedures that I offer are the ones where I actually have to do the least amount of dentistry. I know that sounds kind of weird, but if I get to people, if I can help people before they really destroy things, and we have to do a full makeover or veneers all the way around the top. If you could catch them early, a lot of times you can just do some whitening and maybe some conservative bonding or some conservative reshaping, or maybe just put 4 veneers on instead of 10. So, the larger cases are definitely more challenging. They're more challenging for the patients, financially for sure. So, if we can diagnose some of these problems that break down the smile, and we could step in earlier, then the patient, has I think a better and easier outcome. So we have a lot of different whitening options that are available today. A lot of it has to do with lifestyle, age, how busy you are. Uh, Cost is a factor, and obviously what we're trying to achieve. So if it sounds like something you're interested in, feel free to give us a call. We're here to help. So when patients come in with cosmetic concerns, obviously we have a lot of different things we can do. And but I think at the end, when it all boils down to it, is we want to provide an individual treatment plan. We certainly don't want to make everyone look the same. Um, so we want to customize, uh, their individual needs to what they're asking for. So if you're thinking about doing something to enhance your smile, I invite you to come in. Uh, it's a very laid back approach. We'll sit down, ask some questions, take a few pictures, and we'll get to know one another. And then I'm sure we'll come up with a solution that will help fix your needs.